Hi everyone, I'm Matt from Massage Magazine Insurance Plus. We're so excited to have the Zeel team with us today to present on the topic of massage for veterans, how Zeel brings this VA benefit. Our plan is to have a Q&A portion at the end of this presentation, so please drop your questions in the chat then. I'd like to introduce you to Amy Wegel. With over a decade of experience in the spa, wellness, and healthcare fields, Amy is a seasoned leader and advocate for massage therapy. As Zeal's Director of Government Relations, Amy has played a pivotal role in developing Zeal's massage therapy program for veterans, introducing it to dozens of VA medical centers and helping create this rewarding opportunity for MTs and the Zeel provider network. As the proud wife of an Army veteran, this program is close to home and heart for Amy. I'd also like to introduce you to Dr. John Gallagher. John has over 20 years experience in physical therapy, orthopedics, and sports rehabilitation. In addition to being a doctor of physical therapy, John is a certified ergonomic assessment specialist and certified running gait analyst with additional certifications from the Titleist Performance Institute and Functional Movement Systems. He's also served as official physical therapist for multiple professional athletes and a professional sports team. At Zeel, he serves as the director of musculoskeletal health, overseeing Zeel's clinical massage therapy program and helping massage therapists strive for better health outcomes for their patients. And with that, Zeel team, please take it away.
Awesome. Thank you so much for that intro, Matt. It's a pleasure to be here with you all today. Thank you for joining, everyone that is there that we can't see, but we know you're there. I'm Amy Wegel. I'm joined, as Matt said, by the amazing Dr. Gallagher, who leads our clinical team here at Zeel. And then Samantha Murley is our guest host from our communications team, who's going to be helping answer some of the questions that come in. So we are very excited to share this wonderful program that we at Zeel have been working so hard on. And without further ado, let's dive right in. There's John and I. So first off, it's really important to share that Zeel has been providing nationwide in-home massage for over a decade now. Within that time, we've expanded into corporate wellness, which is providing on-site chair massage for companies, as well as hospitality staffing with Zeel Spa. And then, unless you were living under a rock, you probably heard about this little pandemic that happened. And honestly, it completely shifted everything within Zeel. We shifted our organizational mission and our vision, and we started focusing on shifting more into a medical practice, but still keeping our in-home focus. It was about this time that Zeel discovered that the Veterans Health Administration, or also known as the VHA, is one of the only health insurers in America that covers massage therapy as a pain intervention. So this is actually where our VA partnership began, believe it or not, during a global pandemic. Medical massage is a completely covered benefit for veterans with an active referral from a VA doctor, meaning that if the veteran qualifies, there's absolutely no out-of-pocket expense for them, which is amazing. There was no scheduling system, though, in place, or providers prepared to deliver on-site massage in veterans' home until Zeel. Zeel became the first provider within the VA's community care network with a national footprint and full tech integration designed to ingest the unique parameters of the VA referrals and then also deliver clinically prescribed massage on location. Really proud of this. In this way, we're actually helping move the VA forward technologically, which is also something we're extremely proud of. And then it's also allowing us to expand into areas that previously weren't necessarily a good fit for us. So instead of focusing on some of the major cities, mostly on the coast that we're now able to provide opportunities for our massage therapists in places like Manchester, New Hampshire, or Walhalla, I'm probably butchering that, South Carolina, that just came on recently. This program has truly helped crystallize Zeel's entire mission. We're leveraging the strengths of our tech and our amazing network of massage therapists to treat pain in an incredibly deserving population, I'm sure you would agree, of US military veterans. This is my favorite part to share. Zeel's been providing in-home medical massage for honestly just about 2 years now, which I say only 2 years now because the statistics are pretty amazing. We initially piloted our in-home program with only 3 VA medical centers and quickly exceeded the VA's expectations, mainly with our timeliness and tech capabilities. As word began to spread and still does spread, VA medical centers are still continually reaching out to us to learn more about how they can begin using Zeel to treat their veterans. And to date, as you can see on the screen here, I'm really proud to share with you that we've actually provided roughly 50,000 medical massage treatments for veterans at over 50 medical centers across the country.
All right, thank you, Amy. My name is John Gallagher. I'm the Director of Musculoskeletal Health here at Zeel. And today I want to provide you with an overview of the VA program and what it actually means to be a Zeel medical massage provider. First of all, I just want to say it's really been one of the most truly rewarding programs that I've been a part of, and happy to be leading this clinical team. The big question we always get is from people is, what's the biggest difference between medical massage and regular massage? How do the two differ? And the first difference is that massage therapists wishing to provide medical massage must first obtain an MPI number. If you aren't familiar with this, it stands for the National Provider Identifier. Essentially, it is a unique identification number for healthcare providers for the purpose of submitting insurance claims. It's completely free. If you don't have one and you need our help, our team can help you point you in the right direction in obtaining one. It's a pretty simple process. Another difference is that as a medical provider, we can submit and bill insurance companies as opposed to just having a cash-based model. And for the VA, as Amy said previously, it's a completely covered benefit. They have no out-of-pocket expenses, no co-pays, no co-insurances. So it's a really tremendous benefit that the VA provides. Clinically, the main difference is the goal of treatment. Whereas a Swedish massage or a spa massage, you might see the patient or the client 1 to 2 times a year, a few times a year, where the goal may simply be relaxation or stress reduction. A medical massage comes with a physician referral. It's based on a specific diagnosis code. So you're actually treating to a specific diagnosis, and you're setting individual recovery goals for your patient. So you and the veteran or patient will formulate these goals, and you'll work over the course of a whole referral. In this case, for the VA, it's usually 12 sessions. So you'll have 12 sessions to achieve your goals. The biggest thing that I tell providers is in medicine, we want to make goals that are measurable and functional. We want to show that what we're doing is working, right? It's not enough just to say that we want massage. We have to set measurable and functional goals that we wish to achieve. With that in mind, though, the massage techniques that you guys have learned, in school and throughout your careers with continuing education are really no different. Really, the only difference is that you're going to be applying them towards a specific diagnosis. So yeah, really no reason to think that it's different with regards to your skill set. It's just a different process. A final requirement for medical massage is the need for clinical documentation. This is the part that most providers in all forms of medicine really love, but it really is a necessary evil. That being said, Zeel's provider app makes it very simple. We've built an easy and guided process for therapists to follow right in the app, right on their phone. It takes you through all portions of your treatment. So really great resource and something that we continue to improve upon every day as we learn more. So then why is clinical documentation so important? Now, the first thing, it provides a roadmap of the patient's clinical journey. Are they progressing, right? Is what we're doing working for this patient? Are they making these objective and measurable improvements? It's really just, it's one of the most important things to show is that what we're doing is making both measurable and functional improvements in a patient's life towards a specific diagnosis. It helps to ensure that insurance companies will reimburse us for what we do, right? It's not enough just to do the treatment. We need to provide the clinical documentation to support that. And then it really helps to to cover us, the clinicians, right? To prove what we've done on a given day, and show the clinical outcomes of what we're doing. But that being said, don't panic or get frustrated. Everyone gets a little nervous. I've never documented clinically before. So just know that if you haven't documented since back when you were in massage school, or if you've never documented clinically at all, our clinical team is really here to help and support you. So don't be intimidated if it's your first time documenting clinically. Finally, I want to talk about another avenue that we're working on. Zeel is very... we find clinical outcomes data very important, and we're collecting post-treatment surveys for the VA in order to provide this data to prove the efficacy of medical massage, not just for the VA, but in the medical community at large. We want to show how medical massage can be an adjunct or an alternative treatment for acute and chronic pain, for everybody, not just for our veterans. And it's amazing, back in the day, whether it was chiropractors or acupuncturists, it wasn't necessarily recognized in the medical community or a covered benefit by insurance companies, but today they're household, treatment model. So we want medical massage to be exactly that, something that when medical doctors prescribe something for pain relief, massage therapy is one of the first things they choose. And the data we're collecting to date is really, truly remarkable, even by my standards. But just to give you a little idea, I think we've had over 3,500 post-treatment surveys, and 90% of our patients are reporting some reduction in pain following treatment, with 25% reporting significant improvements in their pain. That's a pretty high number for people with chronic pain. We're seeing a 50% reduction or elimination in pain medications, both over-the-counter and prescription pain medication. Another huge goal of Zeel's and the VA's is to reduce pain medication, specifically opioids, right? So really tremendous, the early data there. And, another 80 to 90% are reporting improvements in their sleep, in their mood, their stress, and their ability to increase their activity level. So really great findings, and something we're looking to expand upon.
Yeah, and this work is so rewarding too. We get calls and emails from massage therapists all the time. They're telling us that this work has changed their massage practice and honestly, even their lives. The gratitude of the veterans and the families is also pretty overwhelming. The work is constant, consistent, and steady. One referral or prescription is going to come in a series of 12 massages for the veteran. And then additional massage sessions outside of the initial 12 can be requested by our massage professionals if it's clinically justified. Similar to our consumer in-home massage therapy, Zeel handles a lot of the administrative tasks for our massage therapist. And if you know anything about insurance covered work, you know that the claims submission and payment process can be daunting, to say the least. A lot of times they're still faxing, I know, and it takes months to receive payment. Not with Zeel though. We actually handle all of the billing and claims, and our massage therapists are still paid weekly. Overwhelmingly, massage therapists tell us that they're called to the meaningful work that this is. Massage therapists become a true part of their patient's continuum of care. Unlike spa-style massage, these appointments allow the provider to really collaborate with their patient and treat them from a truly holistic vantage point that puts focus on restoration of the patient's health and quality of life.
Yeah, so I just wanted to follow up then on what we spoke about before. I just really want you to know and understand that, our team is here to support you in any way you can. Like I said, we've designed a great system within the app to provide clinical documentation. We have resources within the app on clinical documentation, on requirements for medical massage therapists. So there's tons of resources that we have available for you. But most importantly, just know that me and my clinical team are here to support you in any way. I'm on the phone oftentimes with providers who just have clinical questions or difficulty with documentation, and they find that very helpful. So yeah, don't be intimidated by the word medical. Like I said, we have a great team here who's just happy to support you.
And then something else that we're really proud of is that at Zeel we have a trust and safety department. And this trust and safety department is devoted entirely to the safety of our patients as well as our provider network. So a member of this trust and safety team is going to be working anytime that there's any Zeel appointment taking place in any time zone across the country. So with that said, and over 2 million in-home treatments completed by Zeel, we feel very confident that our providers and our veterans are in very good hands. We get flooded with heartwarming stories of how medical massage and specifically in-home massage is changing these veterans' lives. Our network of massage therapists are the heartbeat of this program, and they truly embody this mission and Zeel's passion. Take a look at some of these wonderful quotes. I'm going to spare you from reading from the screen, but this is just a small snapshot of all of the amazing feedback that we get all the time from providers as well as veterans. With that said, I just want to say thank you so much for spending part of your day with us to learn how Zeel is helping transform treatment for veterans. And if you're a massage therapist who's interested in learning more about Zeel and how you could be a part of the fun, email providers@zeel.com. It's there on the screen for you on the slide. And our team is happy to get you started, answer questions. And then, of course, we're happy to take some questions that you may have for us right now. Again, thank you so much.
I'll chime in to just get going on some of the questions. David has a question in the Q&A asking how provider payment is determined, and does the pay vary by region? Amy, if you want to talk to that.
Yeah, so the pay is going to vary by region, just as it does with our consumer in-home massage. So if you have a specific area of question, I would reach out to our team, but we certainly share all of that information during the starting process of the application if you're brand new. And then, of course, through the medical credentialing process that John talked about a little bit, but we're happy to help you answer more specifically if you reach out to us.
I could expand upon that as well, Amy. Just know though, like sometimes we know in medicine, right? Sometimes claims are denied and we don't get paid, right? That being said, the way Zeel works is if you complete the treatment and you complete your clinical documentation, you will get paid regardless. It doesn't matter if the insurance companies deny the claim for whatever reason. So you will always be paid if you do the appointment and complete your clinical documentation.
And I think we can also add, just from a really in the weeds perspective, that payment for these appointments is determined by the Centers for Medicare and Medicaid Services. So that's the reimbursement rate that is applied, which may be a little bit different, region to region than what, one might be paid for a standard in-home appointment or a spa appointment. But by and large, the Zeel appointment payment is quite consistent for the medical appointments as it is with other in-home appointments. This is a good one. Monique asks, do you need a specific certificate for medical massage? And John, I believe you spoke about that a little bit earlier, but we can reconfirm what the requirements are for providing these treatments.
Yep. So yeah, you need to be a licensed licensed massage therapist in your state, right? Some states have different requirements, but yeah, the requirement is a licensed massage therapist. The requirements are that you have an MPI number, and then that you just go through our credentialing process, the typical things that you would do in a job, a background check, and things like that. We really follow state guidelines as to what each state requires from their massage therapist.
Paul asks how to find VA medical centers that offer this. He is a veteran and a Zeel practitioner. Thank you, Paul, for the work that you do. Amy, do you want to talk about how the different VAMCs have been prescribing this and how this is kind of spreading VAMC to VAMC across the nation?
Yeah, it's a great question. In theory, we are an approved provider nationwide. So in theory, we can provide VA medical massage to any VA medical center. The actual answer to that is the VA medical center has to kind of, I hate saying buy into it, but they have to, of course, be wanting to have this program, which is a little different being that we're an in-home program. So that requires really my role, which is to educate each individual VA medical center. So in order to find out specifically if an area is or is not, you can reach out to us and we're happy to provide you with who is now and who isn't. But in theory, we hope to be everywhere. And that's my goal. So I'm really just pushing out there. We've got massage therapists in areas where we're not yet at, and they're sharing, you know, hey, did you hear about this? And then the veterans are going to their VA center. So it's the way that we're coming to be is happening kind of differently depending on where you're at across the country. But it's a great question. More specifically, we're at roughly 50, I want to say it's 51 or 52 VA medical centers currently. And by I mean, they're actually sending us referrals. And then John and I have a call even tomorrow with another VA medical center. So it's happening all the time that we're doing these presentations, sharing this amazing information that we just shared with you all with the VA medical centers in hopes to get, I think there's 231 across the country. So we still have a little work to do. But our massage therapists have been great with helping push that.
Yeah, I think a lot of it's education, right? I think there's VA centers who actively prescribe medical massage for the VA that doesn't know Zeel exists. So we're educating them on that. And then there's other VA centers don't even realize that medical massage is an option for veterans for treatment of their care. So that's why, you know, gathering this clinical outcomes data and sharing it with these VA medical centers is so important and vital.
It is, yeah. And to John's point, medical massage, so Zeel has been doing this for 2 years, but medical massage in general is also a brand new offering for the VA. I want to say we only missed that by maybe 6 months. I mean, it really wasn't that long before we started that this was even really being offered widely. I think it's been a few years, like right before the pandemic when they approved it. But yeah, so I mean, it's just all, and like John said, some VA medical centers still are not even utilizing it, and it's approved now. So it's all education. It is all education. Great question.
And speaking of education, somebody who clearly knows their stuff, Michelle asks, last time I looked at the provider contract, the VA said they wouldn't contract with those doing home visits. How are you able to do home visits? Which speaks to the unique nature of our relationship with the VA Community Care Network and how we're able to provide this service. Amy, would you like to answer that?
Yeah. So the VA contracts with 2 insurance companies across the country. This is a lot of information, but it's important. And they are called Optum and TriWest. So they divide the country. One side, which is the East Coast, is Optum, East Coast and most of the middle parts of the country. And then TriWest takes most of that West Coast area. And with that said, we partner with those folks in what they call the Community Care Network. So essentially what happens is if a VA is unable to fulfill massage in-house, right, which a lot of times they cannot because they either don't have a massage therapist themselves or they don't have a budget for massage therapy or whatever, they'll kick it into what they call the community. And that's where we come in. We're in the community. So massage is essentially provided through Optum and TriWest for us through the hands of these VA medical centers. So if a VA medical center is saying that they don't provide in-home care, and I guess I would ask you more specifically, was it massage or just in general massage care that you can answer in the questions, because it didn't sound like it was massage even specifically. A lot of times they aren't. And like we said in the slide in kind of the beginning of this presentation, we are on a national scale, the only one that provides in-home medical massage. In a lot of cases, we're the only in-home massage game at all that exists. So it's a long-winded way to answer your question and just say that it comes back to that education piece. I've been told multiple times by VA medical centers that this is not authorized. And I smile and I say, but it is, but let me explain. And let me just share with you. And here's our statistics. And we're doing this so it's a lot of times, I hate to say that, but a lot of times it's just getting in front of the right people. And sometimes, sadly, a lot of the people don't have the right information. So I hope that answers the question. And Samantha or John, feel free to add anything that you think is important. But that's the fastest version I can give you. It's very complicated.
Yeah, it is.
I mean, Zeel is for what it's worth, and I think Amy covered this, Zeel is the only national provider in the VA's community care network that is able to provide in-home services.
Yep.
So the answer to that is that we made it happen. And we appreciate providers being able to, coming along on this journey with us to make that happen, to bring that care to homes, because it is a unique service that we provide. Peggy asks if therapists can do only work with veterans without participating in the consumer side of the business. That is the case, right, Amy?
Yeah.
Yeah.
Yeah, absolutely. You can do either or, right? You can do a combination of both consumer and medical. You can just do medical, or you can just do consumer. So yeah, there's no restrictions there. We're happy to have you in any capacity.
And we respect too the fact that I've worked with massage therapists for, I want to say, almost 15 years now in my career. So I certainly respect the fact that there are some massage therapists. Case in point, my best friend, who is a spa massage therapist, right? He never has any desire to do anything medically, and that's okay. The same may be for somebody that's more into the therapeutic or clinical type of massage. You can certainly specify that that's where you'd like to be for us, and we'll help you get just there if that's all you want to do. Or if you're well-rounded and you want to do it all, we certainly welcome that as well.
Someone else who clearly knows their stuff, Paula, has asked what code we're using from the VA fee schedule. John, I have a feeling you know that off the top of your head.
Yeah, no, don't quote me again. I believe it's 97124, which is just the massage therapy code. That's what's allowed by what the VA's quote unquote, what they call their standard episode of care, or SEOC, is, and it's 97124, which is the massage therapy. It's just a basic CPT code for massage therapy.
And Monique,
I was there for that question. I was like, I don't know if I know that answer. Yeah. John does.
To the clinical side. And actually, I think both of you can perhaps speak to this question. Monique asked, how safe is this for women? And I assume what she's referring to is the security concerns around an in-home service, whether it's for the patient or for the provider. And perhaps we can speak a little bit about our trust and safety protocols and how that also integrates with our clinical protocols around safety and security.
Yeah, I'll start, and then I'm sure John can add a lot more to this. But I will just say that we, in our consumer in-home line of business, our spa line of business, this trust and safety team that works behind the scenes is really there for you. We know where you're at all times when you're working for Zeel, right? So there's a check-in feature on the app. We know that you've arrived there. Somebody's always there really for your safety. With that in mind, and I always share this because I think this is so important, we trust you as the massage therapist, right? So you are the professional here. If you feel uncomfortable in any way, shape, or form, whether it's a spa appointment, whether it is a just regular in-home appointment with Zeel or a medical appointment, if you feel uncomfortable, you leave. Get to safety, inform us, and our team will take it from there with you or without you, whatever we need to do. There should never be an opportunity ever in this industry where you as the massage therapist feel uncomfortable, right? So we are very passionate about this. This trust and safety team is 100% in your corner in terms of any type of feeling that you get or upon arrival, before arrival, anything. So with that said, I'm sure John can speak to some of the actual clinical stuff behind the scenes, but I just want to make sure that if you are a massage therapist on this webinar right now, that you understand that we feel very passionately about your safety. So yes, it is safe for women. It's my long-winded answer.
Right. It's always a tough question, and understandably so, right? You're going into someone's home. It's always scary a little bit, right? So, the biggest thing I could say is we've been doing this since 2013 as a consumer-based business. And as Amy said, we have a trust and safety team that's just tremendous and remarkable. Like I said, we're there anytime that you guys are working. Our trust and safety team is working. So you can message us, Slack us, call us, anything you need at any time. You're able to leave the appointment. Like I said, we've even had cases where we'll go back and get your massage table for you, just if you ever felt uncomfortable. That being said, it doesn't happen as often as you think, right? You think it's a big, scary place, but it really doesn't happen often. It's really the exception, not the rule. And while we can't control for everything, like I said, we do support you from a medical perspective and clinically. We do rely on the VA, right, to hopefully send us patients who don't have a history of anything like this. When you are a medical provider, you will receive their whole referral, which will give you their background as far as their past medical history. So you might know if they have any other, maybe mental health issues, or if anything like that exists. A lot of times what I will suggest if something like that happens is that you just ask that someone else be there, a family member or somebody else in the home with them. But, like I said, we can't control for everything. But like I said, we do have a great trust and safety team. We have a clinical team that supports you. We rely on the medical doctors who are referring to us. And then, like I said, it just doesn't happen as often as you think. It's just like when you think about it, sometimes a PSCNG guy or an electric company guy coming into your home, right? There's always that potential. But again, those people don't have a trust and safety team standing behind them. So, yeah, it's hard. And then from a medical perspective, we have rules in place with regards to things like COVID and different health restrictions should things arise.
And I will give just a quick blanket answer to those of you who have been asking, is this available in Alaska? Is this available in Nevada? Is this available in Hawaii or Missouri? The answer is kind of yes, and as Amy has said, this service is available to veterans everywhere. They are able to get medically prescribed massage for pain conditions. Primarily, and this just adds a little bit of context on working with VA. Clearly, some of you have had some experience with them, but by and large, the VA makes every effort to treat veterans for their various conditions within the bounds of VA clinicians. Once they hit an overflow point, that's when they turn to the Zeel, to the community care network, which Zeel is a part of. So for situations for veterans where there is not a place where they can go either in a VA medical center or in their local community care system to receive massage, or they have a reason why they would need massage at home, perhaps they have mobility issues or they're homebound, that's when Zeel would come into play. Again, this service is available to veterans everywhere, but different VAMCs there are certain degrees of awareness that we unfortunately can't influence, coming all the way from the VA through the services like Optum and TriWest that Amy spoke about, down to each individual VAMC. We can't thoroughly influence the communication of the fact that this service is available to every veteran everywhere. So we are sometimes at the mercy of really a veteran, him or herself, going to his or her clinician at the VA and saying that they would like to be considered for massage as an intervention for their pain condition. That really is the best way for that information to get up through the VAMC or the VA medical center in order for them to look up the options and discover that Zeel in-home massage is one of them. So the best thing that I would tell those of you who are wondering if the service is available in various locations across the country, what I would say to you, and I think what we would all at Zeel say to you, is if you know a veteran or if you're speaking with a veteran who needs massage therapy or who would benefit from massage for a pain condition, which is what the VA prescribes massage for, tell them to talk to their VA clinician about it. As you often hear in pharmaceutical advertising, talk to your doctor to find out if massage therapy is right for you, because that's really the best way for them to get access to this service that's available for them. They might just not know. Amy or John, if you want to add to that, feel free.
No, I think that's great. I mean, that's exactly right. It's hard for us to answer specifics on where, and I know that's probably very frustrating because you're sitting in your house wondering, can I do this? And like I said, please feel free to reach out and email us at providers@zeel.com for specifics, and our team, our provider team, will make sure that we get back to you and we can answer more specific information for you. But as a blanket answer, I think, Samantha, you covered it. That's perfect.
And a couple of people have also asked about something that we haven't really spoken about yet, which is in-office visits or appointments in providers' studios or facility spaces. The answer to those of you who have asked about that is yes, this is an option. Amy and John, would you like to talk about the in-office program or the in-office part of this program?
Yeah, so funny enough, you know, this in-home that's our bread and butter, right? That's what we've been doing, as John said, since 2013. So we came into this with that was the plan. And what was funny is, as we started to develop this thing in other places across the country, VA medical centers were telling us, listen, we have nobody. Not only do we not have any other in-home providers, we don't even have office locations for our veterans to go to. Or they were telling us, hey, we've got a lot of veterans, we don't have anybody else, but they're saying in-home's not a good fit for them, right? And we know that, all of us know that. It's not going to be for everybody. So we started thinking, could we do this? Let's see. And, you know, so we tiptoed into this. And I say this with a caveat with the word piloted, because we're still kind of piloting this idea, mainly because it's very manual for our team. So we have to credential an actual location versus or in addition to the provider, right? So it's your location, your address, all the things that are required to make your location get the seal of approval. And that's a very manual process at this stage with Zeel. But with that said, we have rostered and credentialed so many we're calling them office locations. It could be your studio location. It could be, you know, you rent a whatever, same thing across the board. We just call it office-based massage. And we've credentialed a lot of offices, and they are just, it's taken off like wildfire. So that's definitely something that if you're interested in, again, reach out to our team and we'll get you started with that process. And that's great, because there are a lot of folks that just for one reason or another, maybe in-home isn't a good fit for them. So, hey, we can also do this, which is great.
Oh, John, you're muted.
Sorry, yeah, I heard my kids coming in from school, so I muted myself. So yeah, so no, just like what we said with consumer and medical massage, right? Can you do one and not the other? Same thing. You can be both an office-based provider and still provide in-home and vice versa. So you can actually do both as well. It just depends on the need of the specific area.
Yep.
And one thing that a lot of people are messaging and talking about frustration they've had trying to work directly with the VA and differences of information that they've received from various VA medical centers relative to the information that we have. And certainly to say that there's a lot of red tape would be an understatement. Overall, what I would, and I think what we would all recommend is to apply to join the Zeel Provider Network if you're not already a member. And we're very happy to see a lot of members here on this webinar today. But if you're not already a member of the Zeel Provider Network, we would encourage you to apply to join because it will give you more streamlined access to these appointments, minus a lot of the, the red tape and the, lack of clear information that one finds when they might be trying to work directly with Optum or TriWest or the VA itself. Amy, do you want to talk about some of the benefits of working through Zeel to take these medical and veteran appointments as opposed to contracting directly with the TPAs?
Yeah, sure. In my role, I am often across the country at different conferences. So I get the opportunity to speak to a lot of our massage therapists. And again, if you're a massage therapist, just thank you. And if you're a massage therapist in our network, thank you, thank you, thank you. We really couldn't do any of this without you, right? And I don't know that that's said enough. So here it is. But the best part about speaking to the massage therapist out in the field is getting some of this feedback, because we just don't know, and you don't know what you don't know, right? And so I have collected a lot of feedback, and I am gathering a lot of what Samantha said you were saying in the chat, which is it is not easy to be just a direct VA massage provider. And there are a lot of nuances that I would say fully that Zeel really makes this process so much easier for you. One of them is the billings and claims. So I met a massage therapist up in Buffalo, New York, who was still waiting to be paid from 3 months prior, and she had to go to the library to fax the claims, billing and claims stuff. And then when that didn't work, she had to go back and fax again because something was wonky with the paper. And you know, I lead with that because, again, as long as you are upholding your end of the deal, right, which is, like we said, like John specified there, it's the clinical documentation justifying this, the treatment, you're keeping track of all this, which again is all in the app. It's so easy for you. As long as you're doing that, you're going to get paid weekly. It's so easy. It's so easy. So none of this waiting 3 months to be paid for a massage that you delivered back in August or whatever. So that's number one. Number two is a lot of the administration that as a massage therapist, especially if you own your own practice, you're in the middle of a massage and your phone rings, or you're in the middle of your massage and you can't get back to a text message or whatever, right? So we really, with this medical massage side of our business, we're really empowering our massage therapists truly to take kind of the reins with this when it comes to scheduling. Once you've got your patient, once you've got your veteran, scheduling the subsequent appointments and all of that, we put that on you and we want you to do that. But initially, when you receive the veteran, we are happy to take care of some of that daunting administrative stuff that happens in the beginning, which is just really finding out scheduling, what's scheduling. In a perfect world, I'm available this day. And then the veteran says, in a perfect world, I'm right. We do all of that for you. So there's none of this back and forth. We essentially just give you the work. And then we ask you to, again, do the parts that that we ask on John's side clinically with the documentation, and then just scheduling those follow-ups with your veteran directly, which is so awesome because you and the veteran might have Tuesdays every single week that are available at 3. And you can just go ahead and schedule those subsequent appointments, which is great. There's a lot of benefit, I think, to that. Again, the trust and safety thing. If I were a provider, I would think that was a huge benefit for me, that someone knew where I was when I was providing in-home treatment at someone else's house, which, as John said, can be scary. It doesn't happen as much as you would think, like he said, where there's issues or things that happen, but just the fact of knowing that someone knows where I'm at and, you know, has a team behind them that's going to take care of something if something does happen in a treatment, that would be a big benefit for me as a massage therapist as well. I'm probably missing some things, Sam.
Of course you are. I mean, they have me. They have me as clinical support. Who has clinical support out there when they're on their own? No,
there's
no.
that guy.
Very well said. I think the scheduling is a big part of it, right? We do have a whole team who will help you with your scheduling. Zeel sends out reminders, so there's not a lot of cancellations, things like that. I think the biggest part, like you said, is the claim submission and not having to deal with the insurance companies and us handling all of that on your behalf is probably the number one thing I would say. Anyone who works in medicine knows how challenging that can be. So, yeah, no, I think you hit quite a few of them, but yeah, it's definitely it's a much more streamlined approach, and we take care of a lot of the red tape for you.
And I think we're going to begin to wrap up here. I'm sorry that we weren't able to get to everybody's questions, but we do encourage you. Again, you're welcome to reach out to providers@zeel.com to ask any questions that you might like to know about joining the Zeel Provider Network. And of course, you can find out more about joining the network and what the benefits are at zeel.com/providers. If there's anything that we'd like to just get to finally, Matt and Hannah, I'll kick it back to you.
We didn't really have anything more. So I hope everyone has a great day and a great week in general.
Well, thank you guys so much for hosting us in this webinar. We are big fans of Massage Magazine and Massage Magazine Insurance Plus. Great friend of Zeel. So thank you for everything that you guys do and that you do for the community.
Thank you for presenting. It was an amazing presentation and I learned a lot during it. I hope everyone else did too.
Thanks, everyone.
Thank you all. Have a great day.
Bye.